Hello, my name is Chris Cruz, so welcome to my second video. I'm sorry I've been out of commission for the last 2 weeks. For one thing, my computer's been out of commission, and also I had fell down at work and hurt my ankle. As you know, I work at the state hospital, and one of the workers in another building had passed out, and so I ran out the building. I was running down the pavement, and it's uneven surface. So long story short, I stumbled. I sprained my ankle really good, and it turned out to fracture my ankle. So can we say, ouch? Yes, that's what I thought. Ouch. Anyway, in taking care of my ankle, I thought, well, I better share some of this information with the rest of the public. There's an acronym I want you to remember. It's called RICE. RICE. R is for rest, I is for ice, C is for compression, and E is to elevate. Now, the R part for rest, basically once you get your wounds taken care of and and you're safe and out of the way and stuff, you want to basically stay off your foot as much as possible. The doctor may prescribe for you to use crutches and perhaps a boot, a compression boot, or even an ace bandage wrap, something to stabilize that ankle and to for you to stay off of it. Staying off of it is best, especially the first week or so, especially. Because if you're out there putting more pressure on it, then your tissues don't have the opportunity to heal. The next initial is ice. You want to put ice on it 20 minutes off, 15 minutes, 20 minutes on, 15 minutes off. And basically you want to put a barrier between your skin and the ice. Now if you leave the ice more than 20 minutes, it loses its therapeutic value. So leave it on 20 minutes, take it off 15 minutes, and one rule of thumb that I tell my patients is to put the ice on, say like if they're watching their favorite TV show. Well, put the ice pack on while your show's on, and then once a commercial comes on, take the ice pack off. So watch your favorite show with your ice pack on, and then when the commercial comes on, take it off, and that usually will be therapeutic enough. And it's easy to remember, and it gives you something to do while the commercial's off. So anyway, the next initial is C for compression, and as I had alluded to earlier, for rest, you may put on an ace bandage, and that is just to kind of keep the wounded area stabilized, and it helps to decrease the swelling, which causes the pain. And then the next initial is elevate, and basically you want to keep the wounded area above your heart. And this helps with circulation, with your blood and your fluids returning back to your central core, which is where your heart's at. And basically that's it. As far as pain management goes, a lot of times your doctor will give you a Toradol shot, and what Toradol is, it's a non-steroidal anti-inflammatory drug. Now, a lot of times they may be shy about giving you the drug if they feel like you're at risk for bleeding, because anytime you get a non-steroidal anti-inflammatory drug, it may cause bleeding. And that's drugs such as ibuprofen and aspirin, in which it's basically what Toradol is. It's an NSAID. And anyway, what you might do, people may not always want to jump straight to the hardcore drugs like hydrocodone or Lortabs. What you might do is take ibuprofen. And what I've been doing as far as my regimen is I've been trying to take ibuprofen, 800 milligrams by mouth, every 8 hours. Now, you just want to run this by your doctor first, because if you're having issues with your kidneys or anything, the doctor may frown upon that and may tell you to do something different. But as far as me, Joe Q average, I'm taking ibuprofen, and what it does is it helps with the inflammation, and also as well as with the pain. And so I'm resting it, I'm icing it, I'm compressing it, I'm elevating it, and I'm treating the pain. And the main thing about pain is you don't want to wait till it starts hurting to take your pain medication. You want to get on a regimen on a routine and just take it, because once your pain reaches a certain threshold, then it's going to be really hard to get that pain down. So you want to keep it at a certain level and just maintain it. Eventually it will go away. So if you have any questions, please do talk with your doctor. If you've fallen down and you have abrasions or scratches on your skin where your skin is broken, you may want to be sure to check up and see um, if you're caught up on your tetanus shots and stuff. And so, and that just keeps you from getting other complications. You definitely don't want lockjaw, because I like to talk too much. No, just kidding. But anyway, just make sure you're up on your shots and stuff, and make sure it's not inflamed. I want to also make another comment about compression. Now, when you compress your tissues, what you're doing is you're putting a ace bandage on it or some sort of bandage like that, and what you want to do is keep your nail beds exposed, whether it be your toenails or your fingernails. And no, ladies, it's not just to paint your nails and stuff. What you want to do is be able to look at the coloration of your toes and your fingers. Now, if your toes or fingers, after you put on the bandage, is white, it means you're getting like no blood to your fingers, which is really not a good thing, because you don't want to cause it to have a tourniquet effect. What you're wanting to do is stabilize the joint. So you want to be able to check your nails. It should be a normal color. If you want to, you can press the nail, squeeze the color, squeeze the blood till it changes color, and then when you return it, or when you let go, it should return less than 3 seconds. And it's normal. It shouldn't be aching. It shouldn't be numb. So, like I said, you want it for stability purposes. You don't want to use it as a tourniquet. You never ever want to use a tourniquet unless it's like an extreme